Monkeypox outbreaks are now seen as a public health emergency of international concern, the World Health Organization, WHO, announced at a virtual press conference Saturday. WHO Director General Tedros Adhanom Ghebreyesus said the decision comes as monkeypox outbreaks have met the 5 elements in the International Health Regulations, IHR, that decide whether an outbreak constitutes a global health emergency. Tedros said these criteria include the unprecedented rapid spread of the virus to many countries, and the risk it poses to human health, international spread, and the potential for interference with international traffic. Tedros said monkeypox has spread around the world rapidly. WHO's assessment is that the risk of monkeypox is moderate globally and in all regions, except in the European region where we assess the risk as high, said Tedros. Under the IHR, when a public health emergency of international concern is declared, international efforts are required to stop the spread of the virus. This could include sharing vaccines and treatments among countries. We have an outbreak that has spread around the world rapidly through new modes of transmission, about which we understand too little, Tedros said. I know this has not been an easy or straightforward process and that there are divergent views. Although monkeypox has been established in parts of Central and West Africa for decades, it was not known to spark large outbreaks beyond the continent or to spread widely among people until May, when authorities detected dozens of epidemics in Europe, North America and elsewhere. Last month, WHO's expert committee said the monkeypox outbreak did not yet amount to an international emergency, but the panel convened this week to re-evaluate the situation. According to the U.S. Centers for Disease Control and Prevention, more than 16,000 cases of monkeypox have been reported in 74 countries since about May. To date, monkeypox deaths have only been reported in Africa, where a more dangerous version of the virus is spreading, mainly in Nigeria and Congo. In Africa, monkeypox mainly spreads to people by infected wild animals like rodents in limited outbreaks that typically have not crossed borders. In Europe, North America and elsewhere, however, monkeypox is spreading among people with no links to animals or recent travel to Africa.
A month ago, I convened the emergency committee under the International Health Regulations to assess whether the multi-country monkeypox outbreak represented a public health emergency of international concern. At that meeting, while differing views were expressed, the committee resolved by consensus that the outbreak did not represent a public health emergency of international concern. At the time, 3,040 cases of monkeypox had been reported to WHO from 47 countries. Since then, the outbreak has continued to grow, and there are now more than 16,000 reported cases from 75 countries and territories and 5 deaths. In light of the evolving outbreak, I reconvened the committee on Thursday of this week to review the latest data and advise me accordingly. I thank the committee for its careful consideration of the evidence and issues. On this occasion, the committee was unable to reach a consensus on whether the outbreak represents a public health emergency of international concern. The reasons the committee members gave for and against are laid out in the report we're publishing today. Under the International Health Regulations, I'm required to consider 5 elements in deciding whether an outbreak constitutes a public health emergency of international concern. First, the information provided by countries, which in this case shows that this virus has spread rapidly to many countries that have not seen it before. Second, the 3 criteria for declaring a public health emergency of international concern under the International Health Regulations, which have been met. Third, the advice of the Emergency Committee, which has not reached a consensus. Fourth, scientific principles, evidence, and other relevant information, which are currently insufficient and leave us with many unknowns. And fifth, the risk to human health, international spread, and the potential for interference with international traffic. WHO's assessment is that the risk of monkeypox is moderate globally and in all regions, except in the European region, where we assess the risk is high. There is also a clear risk of further international spread, although the risk of interference with international traffic remains low for the moment. So in short, we have an outbreak that has spread around the world rapidly through new modes of transmission about which we understand too little and which meets the criteria in the international health regulations. For all of these reasons, I have decided that the global monkeypox outbreak represents a public health emergency of international concern. Accordingly, I have made a set of recommendations for 4 groups of countries. First, those that have not yet reported a case of monkeypox or have not reported a case for more than 21 days. Second, those with recently imported cases of monkeypox and that are experiencing human-to-human transmission. This includes recommendations to implement a coordinated response to stop transmission and protect vulnerable groups, to engage and protect affected communities, to intensify surveillance and public health measures, to strengthen clinical management and infection prevention and control in hospitals and clinics, to accelerate research into the use of vaccines, therapeutics, and other tools, and recommendations on international travel. The third group of countries is those with transmission of monkeypox between animals and humans. And the fourth is countries with manufacturing capacity for diagnostics, vaccines, and therapeutics. My full recommendations are laid out in my statement. I thank the Emergency Committee for its deliberations and advice. I know this has not been an easy or straightforward process, and that there are divergent views among the members.